Susan is the Director of Patient and Clinical Services for Blue Ridge Home Care, is that right?
Correct.
How long have you been doing this, Susan?
I've been with Blue Ridge Home Care since 1993, and I've been the Director of Patient Clinical Services since 1995.
So with that title, what do you do every day?
I oversee the patient care that's being provided by the different clinicians at the 5 branches for Blue Ridge Home Care, and I'm an active clinician for 2 of the locations.
Which means what? You go to the homes?
I go to the homes, I come to the office, I oversee the care and help provide care to clients in their home as it relates to their home medical equipment needs, primarily clinical respiratory services for oxygen, CPAPs, ventilators, that type of services where they need a respiratory specialist.
A very familiar face around the high country. Debbie joins us, who is the branch manager here for the Boone location of Blue Ridge Home Care.
Yes.
I was telling when we were talking with Susan how I've gotten to get to know you guys and your business. This is a first-class company, isn't it?
It is. I mean, patient care is our #1 quality here. We care about our patients. We follow up with our patients. And if you do all that, you're going to make your patient compliant to be able to feel better and just, in general, a better quality of life.
Yeah. Such wonderful folks and such wonderful equipment, too. And I think one of the 2 points we really want to emphasize, number one, that people have a choice as to who they use for home health care. But you guys have the state-of-the-art, latest equipment that's available, right?
We do, and we pride ourselves in that. We keep up with the latest equipment. It's come a long ways from the first day I even started. It's come a long ways. But these are a couple of screening tools. And what these do is they're very small. They're easy to wear. You put them on at night when you get ready for bed. This particular one is a cannula. So you would wear it just like you would oxygen.
But it doesn't give you oxygen.
It doesn't give you oxygen. It just measures how many times you actually stop breathing.
Really?
And if you add this to it, this goes on your finger. So it will actually tell you if your oxygen levels are dropping.
So it records that?
It records that the whole night.
Wow.
We bring it in the next day, we download it, we get it to your physician, and then that's the first step.
Most insurances will cover this?
Most insurances will cover this. Even if it's out of pocket, it's like $38 for the entire
Oh
thing.
my gosh, really?
Really, it's not expensive at all.
So if you're sleeping with a snorer or somebody who you think is stopping breathing several times during the night, this is perfect, isn't it?
It is perfect, and all you need to do is just call us or ask your doctor about it. We can get the order for you. If you're concerned about it, we'll be glad to talk to the physician for you.
And you guys have a neat program to get those meds to them, right?
We do. For our Medicare patients, we actually can have their medications shipped directly to their home. It comes by FedEx. It's there within a couple of days. We do all the filing. We actually file Part B of Medicare. Mm-hmm. That keeps the patients out of what we call the donut hole. That's the money out of their pocket. Right. So if we file B, it actually saves them money. They don't have to get out in the snow or the bad weather.
Listen to all the wonderful services they provide at Blue Ridge Home Care. They really are wonderful folks. And Debbie, as we mentioned with Susan, we want to remind people again, they have a choice when it comes to companies to provide their home health needs.
You have a choice. It doesn't matter who you choose as long as you get the treatment that you need, but you do have a choice. If you walk in an office and they give you one provider and you know we're here, you have a right to say, I want Blue Ridge Home Care.
And that's the name to remember, Blue Ridge Home Care.
That's the name to remember, Blue Ridge Home Care.
And I know you're excited to be in your new location on Highway 105, too.
We are. We've been here since October. It's a better location, easier access. It's working out well.